I think if you look at many of the things that happened in COVID in the systems, the 11 systems we talked about, they were really exemplary. And of course, we weren't just building for COVID. I think a lot of us thought that this is a sort of set of tools and techniques and approaches that we need in a mature NHS that focuses on learning and cooperation and building on what we have rather than having to reinvent all the time. As you can see, you know, the sample population health use cases that have been produced all across the 11. There are so many. And what's remarkably impressive about this is how these sort of basic plans using hard data, but data aggregated and thought about in a different sort of way, really has produced so many major changes across the healthcare system. This program of work is really seen as the model approach to building a digital health record. There is brilliant work outside of this, of course, but the general view is that the work we've done as a collective around this is simply miles ahead. What we have is actually really deep, applicable, reliable experience in the CIPHA program. There is so much benefit to be had in this program, but here's a good example of learning from one another. The full rollout of a digital record is showing that the opportunity to release substantial clinical time by increasing day-to-day use of a digital health record. Greater Manchester identified £25 million, £29 million in clinical savings in Greater Manchester alone. And then similarly, Baines, Swindon and Wiltshire, 13.2 million. But what's really interesting is if you look at the patchwork quilt of ICSs and so on, you can see this stunning work going ahead describing the use case for saving clinical time, yet we see lack of application in lots of other places. So I think we have a huge number of insights now that we know that are data-driven, evidence-based, and we can run on to sort of drive up usage in this area.